All right, gentlemen, we good? How we doing overall with all this stuff? Good? You enjoying yourself? Excellent. It's been a few weeks since I was here. Anybody remember anything that we did last time? What were the takeaways from last time that we came?
Mostly rotation.
Yeah.
Got
it. A lot of the rotation, right. So I looked up, remember how when we finished I said that Rory had back pain when he was a junior because he actually had too much flexibility? So I was looking it up to get you guys numbers on it. So they were talking about separation. So the ability to create speed is the ability to separate the upper and lower body. And it's almost like taking a rubber band and twisting it and letting it go. So they said the average tour player separates his lower from upper about like 44 degrees. And Rory, he does it about 64 degrees, right? So that's why he can, as small as he is, generate so much strength and speed. And that's also where now there's some controversy around lifting heavy weights, but that was the impetus as to why he really got into heavy lifting, deadlifting, because he had just no stability. He was all flexibility. And so that's where, a lot of this stuff comes in and why I'm really kind of making you guys aware of what you're feeling differently, because literally every body is a bit different. Some people have some better flexibility in their back, some people have it in their hips, some people don't have a lot, some people need more strength. So as we're going through some of the stuff that's easy or challenging, it just kind of gives everyone here an idea that it won't be the same for everybody, and if you are going to have a problem, potentially, where it's going to be. So I thought that was an interesting stat. So we talked a lot about rotation. Do we remember where rotation comes from, mostly? Two main areas of the body? I'll give you multiple choice. Exactly. Yep. Hips and shoulders and thorax, right? And so a lot of people that we see at our practice come in with lower back pain at our golfers, and the first thing we do is check their mid-back and their hips, right? Because they could take Advil to get through a round, but they're just going to have to keep taking Advil if they're over-rotating through something and under-rotating through their hips and their torso. So what we focused on last time, you saw we didn't do anything for the lower back. And, core training is a lot of that type of stuff, but you won't do, believe it or not, any real mobility training for the lower back in general. We don't do that because it's not meant to do that. What's meant to do it is everything from the rib cage to about the bottom of the neck, and everything from about the knee to the hip is where all of that rotation should happen. So that's what we're going to spend. We're going to go through a lot of similar stuff. We're going to add more stuff to it. But you saw last time we kind of got a little bit granular with some of it because I want to get you guys an idea to be able to feel what should be happening. So I think it's good that instead of just getting out there and just trying to stretch, it's like if we can think about, all right, do we know at my rib cage I should feel this and I should feel this and get muscles activated, we're going to be in a better position. The other big thing, when I was studying the guys that worked with Rory, they talked about most people will before a round, if they do anything as a warm-up, what do? They do some stretching. They do a ton of stretching. And what they talked about was actually that probably if all you did was stretch, it probably wouldn't be your best approach. Why? It would be like taking a rubber band and just stretching it out all the way, and you have none of that recoil anymore. So some of these little activation type drills, if we had to choose what you would do before a round, it would be the strength, a little bit of the activation. Even though the stretching feels really good, we're essentially stretching you out and giving you range of motion that you don't really have. It's just kind of temporary, and sometimes it can screw you up even more. So a lot of these stability and these light activation drills that are quite easy, a lot of them are standing. This is what we're going to talk through as we get closer to the season about a nice 5, 6, 7, 10, 15-minute warm-up depending on what you're doing. And the big thing for me is I'm pretty basic with my advice. It's like, well, what should I do before a round? I was like, if you're not doing anything, let's do 5 minutes. If you used to do 5 or 6 minutes, maybe let's do a better 5 or 6 minutes. If you come early and you have 15, 20, then we can build a certain routine. So, I'm not naive enough to think like most guys get out of their car, put their shoes on, and, first tee. So we just want to do a little bit of something if we can. All right.
He's met Joe Fusco.
And 95% of every golfer that walks out. Okay, so the first thing that we're going to do, we did it last time. We're going to do a series of exercises on your lower back. So the first thing we're going to do that's a little different is we're going to talk about some hamstrings and some glute stuff. So I want to get you guys to start feeling glutes and hamstrings. So You're going to lay on your back. If you weren't here, you're going to be on your back, face up. And we call this 90-90 position, where your hips are at 90, your knees are at 90. And I want your feet to be flat, or your heels to be flat on the ground. If you guys feel like it's a strain to keep your head flat, that's why we have the yoga blocks. So don't allow yourself to strain. That's not part of the drill. So you can take a yoga block and just put it on your head. I would rather you guys be comfortable here to start, because we're going to work through some of our drills. So just let your head be relaxed if you need it. So let's all go start with that, and I'll talk you through it. All right, so hips and knees at 90 degrees. You're going to let your feet relax. You're going to let your feet relax on the, so scoot your butt up a little bit more. Good, perfect, good. And so let your butt go on the ground. So the first thing we're going to do, I want your feet straight up towards the ceiling, about hip width apart. So don't let, your knees shouldn't be knocking. Nothing we're going to do is let your knees knock, okay? Now, the first thing I want you to do, it's going to be pretty basic. Just scoot your hips up a little bit if you can, this way. Yep, so your knees are bent more. So keep going that way. What I want you to do is dig your heels, not moderately hard, but I want you to just dig your heels into the bench or the mat. And what you should feel is behind your legs, your hamstrings, just start to activate a little bit. So your back should be flat on the ground. You're going to dig your heels down into the ground or into the mat. And what you should feel is behind the legs into the hamstrings. Now, some of you may actually cramp from this. That would be normal. That means you're on the right spot. But what I want you to get an idea of is that your back is flat on the ground, and you should just be feeling, just push down a little bit, good. Just feeling the back of your legs a little bit more. Does everyone feel that? Yep. Okay. So now, as you're pushing down and doing that, the next thing I want you to think about is your lower back flattening out against the ground. So I want you to push your lower back really, really hard into the ground. And what you might feel there is your abs actually starting to engage a little bit. So you're pushing your heels into the table or the ground, and you're pushing your lower back down as well. So you should feel the back of your legs, and then you should feel your lower back crushing the ground. And this is just getting your legs engaged, getting your abs engaged, and getting neutral. And you're just going to hold this position. And if you need to take a break, you take a break. So I want you to hold for 10 more seconds. So this is getting abs engaged, hamstrings engaged. Good. And now the next thing that I want you to do is I want you to dig into the ground hard enough just so that your butt lifts off the ground about an inch or two. And then you're just going to hold for 10 seconds. So if you're pushing hamstrings into the ground and then lift up, good, and hold it there, good. Doing okay? Good, lift up a little bit, so you should feel glutes, hold for 10, and then you're going to go back down. Everyone feel that? Yeah. Good, go ahead down and relax. What do you guys feel with that? Anything working? Back of the legs, yeah. butt muscles a little bit? Yeah. Good. So really, really basic. So what are we doing? We're engaging the lower body, we're engaging your core by just setting the position, and then we're just getting some isometric holds in that position. Like we're going to do 3 sets of that. So ready, set, go up. So back flat, heels into the ground. Good. And just hold. I want knees in a line with your hips. So if you have to err on anything, widen your knees out a little bit. I want everyone to be wider. Remember we talked about that squat position, that Sam Seed squat? Yep, knees outside of your hips. Hamstrings on there, good, and lift up a little bit. Good, perfect. Good, and then relax. Good, doing okay with this? Good. All right, one more set like this. Good. Try to breathe a little bit. Don't hold your breath. All right, good. Now, we're going to try to advance this a little bit. If you can't do it, that's okay. But what I want you to try to do is we're going to do exactly the same thing, but then very slightly, we're going to try to put all of the pressure in one leg at a time. So all that's going to mean is you're going to slightly bridge up and then try to just march in place. And that's going to force you to engage one leg at a time, glutes and hamstrings. So everyone bridge up to the top. Good. And then just try to to lift one leg, good, and then try the other, good. And then just keep switching. Do about 5 on each side. Good. Just go put this back. Lift your head up for me. Yeah, just keep that in there. I just want your head to be neutral. Good. 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 And once you do 5, take a break. Doing okay? Good. Good. And then relax. Good. Harder a little bit? A little bit harder? Good. All right, now, doing okay? Yeah. Right? Good. All right, so this time we're going to work the upper body a little bit. Remember, the abs and core don't move. So this time, I want everyone to put their arms out in front of them like they're going to bench press. So arms up a little bit at shoulder height. Good. Good. Make a fist if you can. So this time you're going to bridge up and you're going to slowly start to bring your arms overhead. Now, remember that core position. We're only going to bring our arms as far back as we can without feeling like this part's rising at all. So go ahead and lift up. Good. Good. Yep, both arms at the same time, so lift up and good. Raise, 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 and engage there. Good, and bring it back. Good. Perfect. Good. Good. Just do about 3 or 4 of those. Good. Again. Lift up. Good. Ribs down. Good. That's it. Good. Perfect. 2 or 3 more. Good. Bridge up. Arms back. Good. Knees out. Good. Perfect. All right. Now we're going to go back to one of the drills we did last time. So butt down, heels on there, both arms in that same position again. We're going to do that rib rotational drill. So what does that mean? That means that you're going to try and reach, to start, it's going to be basically your left shoulder to your right knee or hip. And you're basically trying to feel your rib cage and your mid-back rotate, and everything else is relaxed. If you feel it in your lower back, you're doing it wrong. So it's rotation, and try breathing with it. Good. So try to keep your head relaxed. So head relaxed. So head down. Good. It's a small motion. Good. So head down and just head and just up and over and feel your ribs. Nope. Head down.
Head down.
Head down. Good. And bring it back. Good. And then ribs across. That's it. Good. So we're trying to get everyone to feel a small motion, what it's like. So head down. So it's a smaller motion than you think. It's just going to be good. You should feel that. That's it. Good. And then the other side. And that. Perfect. Good. And I want you to keep your heads down. So head down. Good. And that's it. Good. Head down. And then other side. So you guys are getting overzealous on me. You're trying to go too much. Remember, there's a small motion. All we're trying to do is get everything we can out of your rib cage. So feel that a little bit? It's not a lot of motion. If you feel your neck, if you feel your lower back, you're doing it wrong. Good. Reach up a little more. Good. And then the other side. Good. Good. There. Good. Good. You okay? Yeah. Cross. Perfect. Good. Take a break. How's that feel? Feel your ribs working, your upper abs a little bit? If you feel your lower back, if you feel your neck, call me over. I'll help you out. All right. This time, we're going to do the same thing, but as we lift one arm, our other one's going to pull back. So it's almost like you got bow and arrow on one side, bow and arrow on the other. It's just going to help you with your rotation. So it's up, rotate, rotate. So when one arm reaches across, the other arm pulls back. Yep, exactly, like a punching motion. That's it. Good. 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 And try to get a little bit of a rhythm here. Good. That's it. Good. And again, you're just feeling your rib cage. Good. Down. It's like you're punching. That's it. You okay?
Yep.
Reach up and across. Perfect. Good. Good. Yep. And really try to pull the bottom arm down and punch the other arm up. Pull and push. Pull and push. Good. Pull and push. Good. Perfect. Good. Keep going.
Keep the arms straight.
Yeah, you're doing perfect. Good. Drop this down and pull that down. Bend your elbow. Good. And then punch across. Good. And then, yep, exactly. Yep. That's good. Take a break. Any questions with that? We're going to do that a couple more times. Again, remember, we're taking everything, our rib cage, our mid-back, our torso, it's all the same thing. We're taking that and we're just trying to rotate that around the rest of our body with nothing else moving. So literally I want nothing else to move. If you guys, the way that I'm watching you is basically to see who's going too far, right? I don't want this to be a far motion because what I want to happen is I want to maximize everything that we can from your abdominals, from your rib cage and your thoracic spine, because I know from an anatomy standpoint, that is the thing that rotates the most. And when we run into trouble with our neck, with our shoulder, with our lower back, it's because primarily we're not getting enough out of that middle area. So I would much rather, if you came to see me with lower back pain, I would much rather start by getting the things moving that are supposed to move, and then we'll address why, the pain that you're having. So I want to maximize, we want to maximize torso, ribs, thoracic spine, we want to maximize hips, and then we can fix the low back, the shoulder, all that type of stuff. So let's try to do that again. We're going to do a set of 10, and remember, it's just reach and rotate, and pull and push, and breathe with it. The more you breathe, the more you coordinate your breath. It's like doing karate. It's like the tennis players that kind of breathe with it. Reach and rotate, breathe. There you go. You're doing much good. And get a little bit of a rhythm, just like you're taking a practice swing. Rhythm. Good. Reach up and across. More. Reach. Yeah, good. And then reach up and across. Perfect. Good. Keep going. Get about 10 on each side and take a break. Great job. You're doing awesome. Good. Really good. Really good. Good. Take a break. We'll do one more set and then we'll get you up. Anybody have any questions, comments, concerns on any of this? No? Feels okay? Does everyone feel their kind of upper abs, ribs, muscles sort of working a little bit? No back pain? Good. Okay. Last set on your own. Do a set of 10. I want to hear listen. I know you're doing it right. If it's you'll get more range of motion. Your abs will be working a little bit more. Good. Reach and rotate. Reach and rotate. Good. 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 Good job.
I'm a quiet breather.
I say to my kids, if I don't see your teeth, I don't think you're breathing.
Good. Try to get that shoulder off the ground if you can. Reach. Good. When you get to 10, take a break and then stand up and we'll get going with the next thing.
I lost track.
That's all right. I don't count very well either. All right, whenever you guys go slow getting up, if you're breathing hard, it might just make you a little dizzy. That's normal. All right, let's just kind of, Shannon, could you just help get the mat just so we have a little more space? Guys okay?
Move out of the way, right?
Yep. All right, everybody just take one. Don't swing and kill each other, please. I don't think the insurance, we're not actually going to swing, we're just using it as a stick. I don't think the insurance is good enough to worry about anyone having their teeth knocked out. Don't worry, we're not swinging, so it doesn't, we're just using it more for a visual. Anybody else? There you go. You got one. Everyone's good. I just need one. It's good to hit with bad clubs, though, because then everyone has an excuse, right? All right, so again, the big thing for me is to start to show you, we can do drills on our back all day, and that's cool. But obviously we need to translate, and I always think that if we can connect the dots between what we're doing on the ground to what we're doing when we're standing, it's going to benefit you guys a heck of a lot more. So the reason why I have the stick is just to give you a little bit of an idea. We talked last time, but I'll review. I'm going to stand back here. What are the two, on a backswing, let's just take a righty. What are the two things that get you into your backswing? Rotation, so shoulder rotation, and then what's the other thing? That crunch, that side bend, right? So if you think about it, we're kind of rotating our body, and then we're trying to side bend down. And then in order to go the other way, we're trying to rotate our body and essentially side bend the other way, and I'll show you what that looks like. So if we just stood up here, and you'll see guys that don't have good mobility, you'll see in their backswing what happens is they start here, and by the time they get to the back, they're kind of up like this because they don't have the ability, the mobility to stay tilted. So all you did was rotate, this is where you would be, right? So we need some of this side bend. Now if we're too stiff through here, we're not going to get any of that, right? And then on the way through, if we need to rotate the other way and then have side bend the other way. You know, a lot of times you go for a lesson, what is it? Early extension. Why? Because we can't side bend here, so we lift up and through. And so when I taught that seminar a couple months ago, when we first started, one of the things I talked about was Jack Nicholas, his coach, who used to hold his hair on his backswing, and then as he came through, and as he got older, what you saw was as he took his backswing, he was okay, but as he upright. Yeah, that's true. That's true. Well, as he got older, not only did he lose his hair, but he actually started standing up tall. So maybe they pulled it all out of him. All right. Exactly, right? But if you don't have this side, the tilting, if you don't have it going back, what happens? You stand up. If you don't have it going forward on the downswing, you stand up through it, right? Okay, so all we're going to do now, get into your stance, get into your address, and then we're just using the club just to kind of show you where your shoulders will go. Remember, this is a small motion. We're not doing a full swing. Everything from basically the bottom of our ribs, let's just call it our belly button, down, doesn't work right now. We're just in this position. All we're going to do is we're going to translate that little side thing that we did, that side crunch, and basically we're going to take this left rib cage and try to crunch it down to our right thigh. So it's down and across and then back forward. We're just going to do 10 each way. And if you're a righty, your left, it's going to be left to your right left shoulder to right hip. And if you're a lefty, the opposite. So it's just that side crunch. That side crunch down, you'll just feel your abs engaging and rotating through. And keep that side bend and just tilt. Good. Good. And try not to move from here. Go ahead, rotate. Good. And try to keep. Good. Perfect. Good. And again, this shouldn't hurt your back. It shouldn't really hurt your knees. Good. All I want to see is that side crunch. Good. Now, it feels okay? Good. Now, let's get that side crunch, and now let's get that side bend. So watch my club. I'm here, and then let's just exaggerate a little more. I'm just going to tilt down. And what you should feel, right now, I feel this side kind of working, and I feel this side stretching. And again, what we're doing now, you'll probably do it more than you would in your round, but that's what we're practicing. So you're going to rotate and then tilt, and then rotate and then tilt. And I want it all just coming from the torso. Nope, the other way. So you're going to rotate, okay, down, go ahead, back to your backswing. Good, and now this way. That's it. So you feel this opening?
Yeah.
Good. Yep, and then tilt a little more. So go ahead, rotate, backswing, and then just try to tilt a little more. Just to get that stretch, just see what it feels like. Good, and stay square. Good, and then tilt down. Good, yep. Rotate, good, and then a little bit more. Perfect. Good, rotate down. Very good. Excellent. Yep, perfect. Good. Now, so the opposite way. So you're going to finish your swing now. So for the first couple rounds, just like we did last time, we're going to go. So for me, I'm a righty. So my right shoulder to left hip, just rotate this way. And I'm not moving anything. I got nothing going on in my hips. I got nothing going on in my lower back. Just taking my right shoulder to left hip, and I just feel my abs engaging. So just do 10. Your eyes shouldn't move. Your head shouldn't move. You're just kind of spinning yourself around at the top. Good. Good. Perfect. Good. Good. All right, now, same thing. So we're going to get that side bend, so address position here. So now you're going to go into your tilt, like you're swinging, and then I just want you to think, watch my club, it's just going to go down a little bit more. So I'm going to be kind of in my squat position, but I'm just going to over exaggerate. So right now I feel, if I'm a righty, I feel my right abs. And I kind of feel this whole side kind of like opening up a little bit. It's okay? So downswing. So it's your rotation and then your tilt. Good. Rotation and then your tilt. Good. Rotation and tilt. Good. Yep, good. I'm going to hold this so you don't move this way or this way, so just rotate. Yep, exactly. Good. Exactly. So I know it's little, it's small motions. So now go ahead. Yep, go. You're doing great. There, and then just a little more of this. That.
Okay. Oops,
Perfect. Now you're good. Good. Now, what I want to show you today, and again, I'm not a swing coach, so if you guys and people teach you to do certain things, that's fine. Everyone has different leg action, arm action, everything. But in general, certain things do have to maneuver in a certain way to get to your backswing and through your swing. So what I want to do now is basically the opposite. And I just want to get into our stance, and I want you to feel what it's like to get rotation on a hip and rotation on a hip, and then rotation on the outer hip. Again, so remember, it's upper body rotation, and then it's really lower body rotation. I just want you to see. So let's all do, if you're a righty, let's do your left leg. If you're a lefty, do the opposite. And what I want you to do, everyone watch, just get in your stance. I want you to just think like, and you can lift your foot up for now. I know it's different people teach different things. Let your left knee come in, but nothing else move. Good. And then bring it flat, and then do that again. Good. And this should be all, nothing from the waist up, all from the lower. Sorry. So I didn't explain that well enough. My upper body's not moving. It's just going to be my hip. 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 Good. Good. And now, same thing on the same, so if you're a righty or left leg, just let that knee rotate out. So you're almost coming on the outer edge of your foot. Good. And you should just feel hip. It's only hip. It's like the stanky leg. Left foot out. Left foot out. Good. Exactly. And this should all be hip rotation. Just think about hip. Good. So this doesn't move. Good. And just let your, yeah, exactly. And don't move from here at all. Just try to move your hip. Yep, exactly. Just that. That's it. Perfect. Exactly. Perfect. Good. Good job. Excellent. Good. Now let's just switch legs. Right? So if you're a righty, it'll be your right side, and just let that leg come in, and then leg come out, and then leg come in, and then leg come out. Again, this is exaggerated a little, but it's just your hips moving. Good. Just the leg coming in and coming out. Good. Do it again. Don't move from here. Good. And then right foot out. Good. Bend your knee a little bit. Good. So let it kind of cave. Good. And then rotate the other way. Yeah. Better. Good. Small motions. Sweet. All right. Excellent. Now, let's kind of put it together, right? So if you're a righty, I just want you to exaggerate it. I just want you to think I'm going to rotate my upper and let my lower kind of come, and I'm going to just do slow rehearsals. What I'm thinking is I'm just letting my legs kind of move, and I'm letting my torso kind of move. My legs and my torso. My legs and my torso. My legs and my torso. Nice and smooth. Good. Good. And come through. Good. Yep. Good. Good. Very good. Yep. Good. Okay. Now, last one. I just want to show you guys this. Remember last time I talked about how I was watching a lesson being taught, and I could tell that if the guy sort of understood how to squat, like if he ever worked out in a gym, he would understand. one of the things for me, I've always worked out in a gym, but I've always heard like you need to use your legs to generate force. But until I actually understood what that meant, it was kind of irrelevant. I could have deadlifted 700 pounds, but if you don't figure out how to translate it, then it's going to be an issue. And so one of the guys that I've watched a lot, old clips of like Sam Snead, and so they call it the Sam Snead squat, where he basically gets to the top of his swing and he's kind of standing up tall. And then from there, what happens exactly? He kind of gets into if you watch in slow motion, it's this motion, right? So what we're going to do very easily, just so you guys can feel what it's like to get your leg going a little bit, we call it a plie squat. So start with your feet together. So if you're a righty, you're going to move your left foot out, but don't do it yet. If you're a lefty, it just switches. So we're going to do a plie squat. So your heels are together. You're going to, if you're a righty, bring your left foot out almost like you're going to be opening up your hips for a shot. And then from there, I just want you to think knees stay over your toes. I want you to just come down and come back up. And we're exaggerating it here. And down and back up. So now you're letting your knees bend, you're letting your hips go. You're letting your knees bend and letting your hips go. Good. Now again, we're getting your hips open a little bit. But this is a basic squat that we would teach anyone to do, but just kind of give you a little more context on how it might work if you're able to use your legs a little more in your swing. So again, if you go on YouTube and just search this, what you'll see in slow motion, again, I'm not Sam Snead, obviously, he'll get to his backswing and he's almost like standing up tall, and then in slow motion, his next motion will be this. Gets to here and then he comes up through. So it's almost like he gets in his backswing and he squats through and then he gets forward. We talked about Matty Wolf last time, and they said that he generates more force through the ground than any other tour player they've ever tested, right? He did more force and torque. And if you, again, watch him, he literally gets here, gets down, and then he almost, if you watch in slow motion, after he makes contact, his feet actually go backwards because he's generating so much pressure off the ground that, he's able to push like that. Okay, so everyone put their club down. So that was good for that. Anybody have any questions on any of that? No. So we're going to go back through some of our shoulder series last time. So for the guys that weren't here, we worked on shoulder blades, we worked on the shoulder joints. And again, if we can get our shoulders up and through positions and control those positions, we're going to be able to stabilize, we're going to be able to come through shots. So the first thing we're going to do is work on the shoulder blades. If your shoulder blades don't know how to move, this is what your golf swing would look like. If you just kept your arms in place. In order to get in a backswing, your arms have to get up, your shoulder blades have to move. In order to get through the ball, your shoulder blades have to be able to move. And so, different than just getting out there and just kind of randomly stretching our arm, what we worked on is activation. Getting you to understand that your shoulders move, but making you actually do it as opposed to me just coming in and pulling on your arm. There's a time and place for that, but I think this is much more beneficial and useful. So, everyone get into their nice neutral stance. Get into kind of a, not your full stance, but just an athletic position. And let's everyone take their right arm out in front. And we call these straight arm punches and pulls. So what do? We want to be here. We want to punch our arm forward. And then we want to pull our shoulder blade all the way back without moving anything else on our body. Right? Now just go slow, go through, and I'll walk around and help you guys. What I don't want to see your shoulder coming up to your ear. So I don't want to see this. I want you to try and work the lower muscles here so your shoulder stays away from your ear. Good, way better. Good, and pull back, elbow straight. Good, and then bring it back. Good, drop this down. There you go, good, and out forward. You'll get it. There, you got it. Yeah, don't move this. Way better, elbow straight. Good. So I'm not going to let you move from here. So pull from here. Nope, not from there. I got you. Let me do it. Good, and punch forward. Good, and pull. Good, drop. There. Yep, and punch. You're good. There you go. There you go. Again. Feel that? Feel this kind of working? Yeah, good. Keep going. Doing great. You're not allowed to move your elbow. Just here.
Okay.
There you go. Good. Punch and pull. Good. And then let's do the left side. Really good. Way better than last time. Yeah. So if you're getting cracking in like kind of back here, don't be concerned. That's literally just probably the first time your shoulder blade has actually moved down your rib cage in about 2 decades. It's just the muscles rolling over the ribs. Now, again, we talked about a lot of guys get elbow problems, and so one of the things as I watch you guys do this is we're basically asking you, can you move your shoulders without your elbows bending, because your shoulders are much bigger than your elbows. So if they're not working and your elbow takes over, it's like, well, of course your elbow is going to hurt. It's doing a job it's not supposed to. Good. Good. Now hold it there. Elbow straight. Drop your shoulder down. That's it. So we don't want this to work so hard. We want this to work so hard. Good. Good. Punch and pull. You guys are doing awesome. Go a little slower. Slow. Good. And pull back. Yeah. There you go. Good. And punch. Nice. And pull. And now when you do it, drop this down. Yep. Good. Punch.
I was out too far in front of
Yeah. No, you're doing good. Yep. Yeah. So your shoulder blades sit on the back, kind of on the side. So yeah, almost if you're out a little bit, like 10 or 15 degrees to the side as opposed to around you, it'll be a little easier. Good, punch and pull. Good, now let's try to do both arms at the same time, but don't do it yet. Watch me for a sec. Once we do both arms at the same time, one of the ways that everyone will compensate is this. This will start to move. Right? We don't want this to happen, right? It's not meant to do this. This is normal though. Even if you were at the gym and we were training you and you were doing a row, what we see all the time is people pull the row and they kind of let their chest go here, right? It's kind of like they squeeze their blades together, and we don't want to necessarily do that. We want this to not move. This shouldn't move. This is neutral. Remember that we're rotating for everywhere else but here. So we're punching forward and we're pulling back. It's going to be a smaller motion than you just did. It's going to be hard to do, but your chest shouldn't move. Punch out and pull back and go smaller than you think. Good. Good, so now you get there, do it again. But now instead of these guys working, I want these guys to work. Yep, exactly. Small motion. If you guys are doing a big motion, good. So now less of this, go ahead, do it again. Now drop these. Yep, exactly. So we don't want these guys to work, we want the ones down here. Perfect. Good. So I keep correcting a lot of people on the same thing, so just take a break. I want to show you something. So a lot of times in our office we see, you're right?
Yeah.
We see a lot of people that come to us with chronic neck type stuff, and typically the presentation is this. They say, like, I get a massage, or I go to the chiropractor, and it feels good when I'm done, but then like a week, a month later, it just all comes back. The tension comes back. And so what we find a lot of times is I start to look at some of this type of stuff, especially if they're active. And what I want to see is that the muscles that are getting tight, are they just working too much, right? So you could get adjusted, you could get massage, but if these muscles are working too hard, you're going to continually have a problem. So the muscles at the top of your shoulder, a lot of people feel stress, tension. You're working at their desk, their kids go nuts and they do this all the time. And these muscles just create a lot of tension. And so when we start to look at some of these movements, it's basically a tug of war. You have muscles, they're called your upper trap on the top part, and you have lower trap on the bottom part. And they basically are just playing with each other all day. Most people, these guys win. So what we have to try to do, as opposed to these guys winning, is we want these guys to win. And it's really, really awkward, right? So what I want you to think about is every time you go and you feel like this is happening, just let your shoulders drop. Let your shoulders drop. So your shoulders should be away from your ears. So let's try it one more time. Arms straight. Good. Try to pull these together. Good. Now hold it there. Good. Now drop. Yep, exactly. Good. Yeah, it's weird, right? Good. Really good. 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 And try to squeeze your blades. Yep. Awesome. That's great. Good. Do it again. So stand up a little taller for me. Put your butt underneath you. Good. No, the other way. Yep. Good. And now do it. Yep. Down. Drop these. Weird, right? Yeah. Punch forward. Good. And now do it again. So you feel these are lifting. Do it again and pause at this position. Pause. Straighten your elbows. Squeeze these together. Good. Now drop these down. See how now these aren't working so hard as opposed to when you started these were? Good. Drop. Good. Do it again. Good. Now drop these down. Yep. Exactly. And just stand this way for me.
Okay.
Yeah, yeah. Good. Do it again. Squeeze your blades. Good. Drop these down. Good. Take a break. Weird, right? We all want these to work, these to work, these to work. It's weird. It's something that we see often. And one of the things that I observe a lot of times, more females, because a lot of times they're skinnier, is that they have very skinny everywhere. But up here, they have like muscles that are really developed. And that's like my telltale sign that they do everything like this, right? And it's like, we all know that's super type A. They go, 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 go. Actually, I was watching a lesson this week, and there was a guy, I could tell, he knew him right away. He was like 38 years old. He was like this the whole lesson. And he was like super successful, whatever. But he literally go in this backswing, and like his neck was like bulging out. I was like, oh my God. Like and it was like, just take a breath. Like, and they were telling him rehearsals, go slow, go slow. We get there, be like, it's like, just go slow. It's okay. All right, so we did shoulder blades. Now, remember we did the actual shoulder. So we did the blades first. We got motion out of those. Now we're going to really work the shoulder. So remember, one of the compensations, we're going to take our middle finger and we're basically going to draw the biggest circle that we can. Now, what ways are we going to compensate? We're going to bring it forward, and then because we can't go any further, we're going to extend at our lower back. And so last time, I think you had some lower back stuff doing this, right? So we really have to be conscious that this isn't moving. So I would we're going to do right arm first, take your left arm and just kind of tuck it here to remind you that nothing's allowed to move other than your shoulder. I want you to take your middle finger, I want you to reach as far as you can. If it hurts at the top, just skip that position, move out of it, and come back. But nothing is moving except for that shoulder. Lift, reach, reach, reach. When you get to the top, you might want to rotate your thumb and then keep that position. Good. Rotate your thumb back a little bit. Good. Lift up. Good. Yep. Reach, 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 reach. Rotate the other way. Yep. Good. Perfect. Good. Lift up. Good. When you get to there, rotate back. Good. And reach, 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 reach. Good. Good. Rotate back. Reach. Good. Rotate. Perfect. Good. Good. The hardest motion will be once you get kind of back here. A lot of people will be real tight in that shoulder extension. So just make sure you stay here and just try to get a little bit more motion, but not too much where you feel like you're hurting yourself. Good. So we went, trying to think, counterclockwise. We're going to go clockwise, right? So now same exact thing. We're going to reach back. We get to about here. Our thumb will probably go up and bring it back over. Good. Do 5 on each side. Just do 5 this way. Go slower than you want to go. The slower you do these, the better. Reach, 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 reach. Higher, 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 higher. Good. Reach out towards me, towards me, towards me. Reach, 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 reach. Good. Good. Reach, 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 reach your thumb. Reach higher, 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 higher. Reach right towards me. Push out into me. There you go. Good. You feel that? Mm-hmm. Good. Reach. Reach, 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 reach. This way. Push out, push, push, push. Yeah, there you go. Good. Reach. So see what I'm doing with you guys? I'm almost like taking your middle finger and pushing it at the edge of it, which would allow you to just think about reaching. Reach, reach, reach. Higher, 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 higher. Reach. More. Push out into me. Good. Push, 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 push. Good. You're too tall for me, but reach, reach, reach. Up. Higher, higher. Good. Reach out towards me. Other way. Good. Nice job. Up. Perfect. Good. We're going to the other side now. Felt that? Get you moving a little bit. So there's a difference between just like stretching. Again, stretching isn't bad. Yoga, it's not bad. It's just different. It's getting those muscles activated, getting you feeling positions that probably you haven't been in a while. And you saw what I did with every one of you is I just kind of gave you that cue of reaching, 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 reaching. And that'll start to work not only your shoulder, but that shoulder blade that we just did. Okay? So let's go left side. Right? Now, this is where you guys might start to see a little difference from side to side. Right? So if you had previous shoulder injury, one side versus the other, you might have a lack of mobility, and that's something to consider. If you were I was a baseball player, so my right arm did a lot of different things than my left arm, so that's something to consider. And there's always a little bit of asymmetry from side to side that we see. The problem is how much is too much and when does it become a problem, and that's usually what we look for in our office because we expect some of it, but we don't want too much. Good, reach higher. Good. Excellent. And when you get to 5, switch. Does anybody feel significantly different from side to side?
Yeah.
You do? Have you had like previous shoulder history or not?
More on the right.
More on the right shoulder? Yeah.
But the left hasn't been worked enough.
Yeah, haven't done much with it. Yeah. Yeah, so when you have something like that, usually think about it.